I would freeze up every time I had to meet someone in authority.
I'm the only one in the world who has these horrible symptoms.
It's just easier to avoid social situations.
I'll mess up and everybody's gonna think I'm a loser.
More than anything, I don't want anyone to know that I'm afraid.
Social anxiety disorder refers to a persistent and overwhelming fear of social situations and negative evaluation by others, to the extent that it causes emotional distress and decreases an individual's quality of life. Along with alcoholism and depression, social anxiety disorder is one of the three top mental health care problems. Social anxiety disorder, previously known as social phobia, is one of the most common disorders, affecting 7 to 13% of the population.
To find out more about how widespread it is, we conducted a survey in our school and got some responses from 40 people from different grades. Our findings suggest that overall, people are concerned about people judging them negatively, 66%. 25% out of the 40 respondents often avoid social interactions, which shows that there might be more, but it is often disregarded.
Our research took us to Dr. Ellen Hendriksen, a clinical psychologist. She serves on the faculty at Boston University Center for Anxiety and Related Disorders and is the author of How to Be Yourself: Quiet Your Inner Critique and Rise Above Social Anxiety. Can you tell us about what is social anxiety and what triggers it?
Sure. So social anxiety, colloquially, is feeling self-conscious but amplified to a great degree.
Mhm.
If we want to define like clinical social anxiety, so social anxiety that can be diagnosed, then that is essentially, I like to describe it as a sense that something is like wrong with us, or something is, we're deficient in some way, and that unless
Mhm.
we're really hard to conceal that or to hide that, will be revealed, and it will become obvious to everyone around us that we are that negative thing, and they'll judge and criticize us for it. So it's a real sense of self-consciousness, at and worry that we will be judged or rejected.
Mhm. So everybody feels nervous, right? But what level of nervousness can be diagnosed as social anxiety?
Sure. Yeah, there are two thresholds for diagnosable social anxiety, and that is if social anxiety causes you like inordinate distress. So that essentially means like that you're suffering in some way. And so the examples that I like to give are if you like lose sleep for like multiple nights before a presentation, or like you have stomach problems before you have to, you know, I don't know, give a toast or something like that. So real like distress, discomfort, not just like a usual, level of nervousness. So distress is one threshold, and impairment is the other threshold. So impairment basically means if it gets in the way of your life. So the example I always give, which I still think is very relevant, is if you like decide, okay, I'm just not going to get that 20% of my grade because I don't want to raise my hand, for class participation. Or if you, for example, like, turn down a promotion or turn down a new job because it might, send you to satellite offices, and then you have to meet lots of new people, or you have to travel a lot and meet new people. If so, again, if it gets in the way of your life, that is impairment.
I see. And how common is it?
Oh, so it depends on how you define it. So if we're talking diagnosable, social anxiety, then 12%, 13%, depending on what country you're in, of people will reach that threshold at some point in their life, and so that makes it the third most common diagnosed psychiatric disorder. So right after major depression and alcohol misuse. So
Mhm.
number three, definitely up there. If you define it just as any socially anxious moment, then 99% of us have experienced that and know what that's like. So that's a near universal phenomenon. Even if it's not like diagnosable or a problem in one's life.
Do you think that despite being so common, it is still neglected, like compared to the other? mental health problems?
Oh, I see. I see. Yeah, well, I don't, that's a great question. I think as, if you were to ask me that question, like even 5 years ago, or, definitely 10 years ago, I would have said absolutely. Now I think weirdly, social anxiety is, having its day, that it's very, I maybe it's just because I see it everywhere, or I have a radar out for it in the news, but I see it's much more commonly discussed. It is a household name now, and so I think it's really having its day. Do I think people understand it? No, I think that's different. I think that when people disclose that they have social anxiety, um, that the well-meaning, response, the well-intentioned response is to accommodate, which can work in some ways, but ultimately allows people to avoid and allows people to perpetuate that social anxiety. And I think that it is misunderstood as something that is like fixed and you will always suffer from it. It needs to be worked around. Whereas if I could, make a pronouncement, I would say that it's treatable, that it is something that has been learned and can not be completely unlearned. There's a genetic component, there's, a long history of experiential component, but it can definitely be tweaked with. It can definitely be rolled back, and people don't have to suffer as much as they do. So that was a very long answer to your question.
Thank you for that.
There you go. So yeah.
So, speaking of treatment, what are the root causes of social anxiety?
Sure, that's the $64,000 question. So the causes are partially genetic. If you have a first degree relative with social anxiety, meaning a parent, a sibling, a child, you are 4 to 6 times as likely to also have social anxiety. So it definitely runs in family. There's definitely a genetic part of it, but a lot of it is learning. Some of it is just simply personality. So it's a big mix, like lots of pieces to that pizza in terms of what actually causes it. So as for what maintains it, 100% that is avoidance. And so the more we avoid something, the bigger and scarier it becomes in our mind. And the opposite of avoidance is approach. And so when we get into treatment, we can talk about that.
Yeah, so let's get into treatment. Is it completely treatable, or is it something that we have to learn to cope with?
Sure. So I think the answer is both.
Mhm.
It absolutely is treatable. I like to use an analogy that like we all have like a range that, some of us are, just genetically predisposed to it, or our brain is just wired that way, or we're just wired to be a little bit more inhibited or introverted, and all those things, go together. And so we might have a range that's like, over here, and that we can absolutely use treatment to get to the top of our range, but we're not going to flip our personality, or suddenly, if we're not going to go from being a socially anxious introvert to somebody who wants to dance on the bar, like we're not going to do a 180. But whatever our baked in range is, we can definitely use treatment or tools or techniques or what have you to get higher up on that range of being able to be flexible and respond to social interactions like flexibly and adaptively.
Mhm. And does it get worse if it is not treated in time?
Often, yes. So it's a mixed bag because as time goes along, you can't avoid everything. So again, avoidance is what maintains social anxiety. And as your life goes along, you get forced into situations, and so you may realize, oh wait, I just gave a presentation, it wasn't that bad, or this thing that I was avoiding. Like you eventually have to do it for whatever reason, and so that can chip away at that social anxiety.
What do you think is the most effective way of combating this problem?
Sure, I will quote Dr. Richard Heinberg, who is a guru in social anxiety research, and he says, "Go forth and do." So essentially, do the things that scare you in the method that I mentioned. So push yourself a little, but not so that your hair is standing on end, certainly. But to do the things you're scared of on your own time, in your own way, as opposed to avoiding. So approach, don't avoid.
Research suggests that 90% of the time social anxiety is even misdiagnosed by professionals and frequently confused with panic disorder. Thomas A. Richards, director of the Social Anxiety Institute, writes in an article about this lack of understanding. Social anxiety is as foreign to counselors, therapists, doctors, psychologists, and psychiatrists as it is to most other people.
To find out more, we interviewed Navreen Kaur, a registered clinical counselor with a Master of Arts degree in counseling psychology, specializing in school and youth. What is social anxiety and what triggers social anxiety?
Okay, so social anxiety is a kind of anxiety which arises in social situations, and we all do have some kind of anxiety when we go into social situations, but a very intense and a persistent anxiety that remains and hinders your functioning when you're in social situations is social anxiety.
Okay.
And what triggers social anxiety? There are a few common triggers, and then there are a few very personal triggers. For someone suffering from social anxiety, it depends how did it start for them and what started to trigger it. For someone, the trigger might be family, an extended family, but for the other person, it might be crowds, right?
Yeah.
And so it's very varied. You cannot always have one definition for the triggers. Triggers are very varied, but I can list some of the common ones, and some of the common ones are crowds and classrooms, going to superstores, walking in the public, performing in the public, and even seeing someone perform in public can be a trigger.
Okay. Is it inherited or acquired?
I think it goes both ways. Mostly it is acquired.
Okay.
Acquired by your environment, acquired by your family dynamics, acquired by what kind of school do you go to, what kind of education are you getting, are you aware about it or no. So, and in terms of inherited, yes, it can be inherited. If a mother is high on social anxiety, it is very much possible that the child born will have social anxiety, because the mother would not prefer to take the child out because she's herself suffering with social anxiety. So that is how a child would never really get comfortable to go into the common places.
Okay. So it's not as much as in DNA, but how they're brought up?
Yes. So inheritance also means your parenting. Inheritance is not always genetics.
Okay.
75% of people have experienced the symptoms of social anxiety before the age of 15.
Okay.
And 7% of the population suffers from high social anxiety.
Wow. Okay. In what people is it more common?
Are you wanting me to talk about the population?
Like what sort of age range or gender? Or
Yeah, I think the onset of this kind of anxiety is usually teenage.
Yeah.
Ages 15 and 16, when a child becomes a teenager.
Yeah.
And they actually have to do a lot of stuff by their own.
Okay.
By
Is that transition?
It's actually the puberty. It's a lot of body changes. Some people get shy of their body.
Right. Yeah.
So there's a lot that goes on physically, mentally, emotionally.
Okay.
There's little transitions. I can quote an example. So I had a client who was always taken to school, to soccer, to every kind of game by their mother.
Yeah.
As soon as they turned 15, the mother demanded, how about you try walking to school?
Okay.
That brought them social anxiety.
Right.
So it's transition in the teenage that actually gives you social anxiety,
Okay.
according to my experience.
Okay. How is it different from introversion and shyness?
I think social anxiety is a mental illness.
Yes.
Shyness and introversion isn't.
It's more of a feeling.
It's more of a feeling. It's more of a choice.
Okay.
And it's more what makes you feel comfortable.
Right.
You can still have control over it. But with social anxiety, you cannot have control over it.
Okay.
Yes.
We're all anxious when in social interactions, so how much anxiety is normal?
There's we feel an emotion, we feel happy, sad, angry. Just like that, when an anxiety goes intense and it's persistent, it is hindering your daily functioning. You're talking to people, you're going out. If it's the piece of social anxiety that's actually hindering you from doing a lot of stuff, that's when it is intense. That's when you should actually step out to go seek help.
Okay.
We all have social anxiety, you
Yeah.
know. I see a group of people and I have to go talk to them. I would feel shy.
Yeah.
That's where the shyness and the introversion would come in.
Okay.
So we talked about how common it is. Do you think despite being so common, it is still like a neglected sort of a condition?
Yes, and I think it's very. I cannot really say the general society, a lot of cultures.
Yeah.
In a lot of cultures, it's said that it's a choice. You're doing it on your choice. Like, it's not really a thing.
Right.
So do you think there is a need for more understanding and awareness?
Oh, yes,
regarding
100%.
this? So talking about treatment, do people reach out for help when they are suffering from social anxiety, or are they hesitant?
There are a lot of people who do reach out for help. And again, there are a lot of people who do not want to reach out for help. There are a lot of factors which actually hinder them. There's cultural stigmas. There's feeling of giving up control when you actually tell someone a lot about yourself. It's actually someone knowing so much. It's being vulnerable. So the difference between treatment and coping mechanisms is coping mechanisms can also be developed by one own self, and they're not medically approved. Treatment options are medically approved. Psychotherapy is the first one. You use cognitive behavioral therapy.
Right.
You use, and so psychotherapy, and then another branch is CBT, which is cognitive behavioral therapy, as we spoke. And one of the very common things that has helped tremendously with social anxiety is known as exposure therapy.
Okay.
Exposure therapy is, for example, you have social anxiety and you're sitting here in my office. I would have you imagine a social situation which gives you an anxiety. We'll walk through it together. It's just a very little snippet that I'm doing, like telling you right now. There's a lot more to it.
So it's like fighting your fear.
Fighting your fears, basically, yeah. It's putting it in a layman language. I would not really quote it that way, but yes, that's a layman language. We can say that you're fighting your fears, and it's not that easy. You can talk, you know. Sometimes it's as equal to you can read a book about driving, but can you really drive on the road?
Right. Yeah.
So the client can talk to me that yes, they will fight the fear, but are they actually really able to do that?
Yeah.
So for the exposure therapy, it starts with little steps.
Okay.
And those little steps are, maybe we'll try to assist client and give them some resources, go to the store when it's not that busy. So first, they get accustomed to the setting of the store. There's some familiarity. When there's familiarity in something, it does not come as surprise.
Okay.
Yeah.
Right? So if they go in not so rush hour, early mornings or late nights when the stores are empty, those kind of things are something that we use in treatment, and we call these interventions.
So if not treated, is it able, like, are we able to get rid of it naturally, or is treatment required for it?
Again, it depends a lot on what kind of person is dealing with it.
Yeah.
What if I'm just not aware it's social anxiety? I keep fighting little demons, and there's going to be a point where I give up. But on the flip side, if I'm aware that it's social anxiety, I can go on Google, I can search what it is,
Yeah.
and I can see if my anxiety is intense, if it's medium, like what kind am I feeling. Again, I would really suggest there's no harm in seeking help.
Yeah.
It's not like you're gonna come here and I'm gonna inject you with a injection, or I'm gonna give you a pill, you know. So there's no harm ever in seeking help, but yes, I would never say that it goes away naturally. It stays, and then you inherit it.
Right. Right.
So it gets extreme with the passage of time?
Yes. Trigger warning, it even goes until the point of committing suicide.
Yeah, that's pretty extreme. So talking about the COVID era, do you think it has had an impact on our social skills?
Oh, yes. I myself feel that.
Mm.
My social battery has gone down tremendously. If I was able to be around people for 5 straight hours, now I can't do more than 2.
So to wrap it up, what do you think is the best way of moving forward in terms of dealing with it and coping with it?
Take it slow,
Mm-hmm.
one step at a time.
Social anxiety disorder must be given the same amount of attention as other mental health disorders because it is very poorly understood and studied, despite how common it is. This causes people to misconceive it as shyness or introversion.
As much research has been done on this, there's still a long way to go. And the first step toward fighting stigma is by raising awareness and education. People must understand that there's no harm in getting the help that they need to make their lives easier and happier.